Well, here it is.
First, the bombshell report.
This disaster was not an accident.
Next, a contrite apology.
I want to make a wholehearted and unequivocal apology for this terrible injustice.
And now, the time to make good on promises. Paymaster General John Glen outlining the government's infected blood compensation package.
If you have been directly or indirectly infected by NHS blood, blood products, or tissue contaminated with HIV or hepatitis C, or have developed a chronic infection from blood contaminated with hepatitis B, you will be eligible to claim compensation under the scheme.
He also announced a further interim payment of £210,000 for the infected. Richard Warwick was a Trelaws school pupil, infected with HIV and hepatitis C in secret trials. The sinister episode earning its own chapter in the infected blood report.
Those that are the most severely infected, they're going to give them another interim payment simply because of the death rate. So I think we should be up and running, hopefully, and payments should be made to people by the end of the year.
John Lister is a haemophiliac who was infected with hepatitis C in his 20s.
I talked to the fellow haemophiliac community, and they feel that it's now going to happen. You know, we're finally going to get recognition and the compensation that we so deserve.
But John's daughter Hannah thinks the interim payments should have been offered to affected families too.
I think it's a disgrace that they're still not recognising these lives. You know, parents, we've lost children, we've lost parents. There's still no recognition of these people, and it's not good enough.
Sir Brian Langstaff's report is damning in its condemnation. Public inquiries are not set up to determine criminal or civil guilt. That's up to the courts to decide. But it doesn't mean that individuals can be stopped from trying.
His support in delivering this scheme will be...
Stu McLean was infected with hepatitis C after he was wrongly diagnosed as having a blood clotting disorder as a 9-year-old. In the report, it says the treatment administered to Stuart showed a cavalier disregard for safety.
Schemes don't bother me. I want criminal. I've always wanted criminal from day one. And I'll be happy with criminal. Schemes and money don't mean nothing to me. These doctors need to be held to account.
For some, the battle for justice is not over. But others will now draw a line under the horrors of the last 40 years. Ashish Joshi, Sky News in Westminster.